Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Thank you very much for having me on the program.
Yes, sir. I wanted to take you back a little bit to the ending of April when UNICEF observed World Immunization Week. And I wanted to talk outside of COVID-19. Basically, how have we been performing as a country? And can you highlight some of the immunization successes that we would have had?
Well, I think, as you know, Guyana has a very strong immunization program. And over the years, Guyana has been recognized globally for this immunization program. Generally, with the pandemic, the COVID-19 pandemic, we have seen countries have not been able to maintain their immunization programs, especially in the under fives. However, despite those challenges, we strive to ensure that we are able to immunize most of the children who require their vaccine. And in the latter part of last year, we did a special outreach program where those children that was missed during the year, that we were able to go out and to get to their homes and make sure that they receive their immunization. And because of that effort nationally, I think our immunization rates are quite comparable with the rates in the previous year. So for example, BCG, we have been able to accomplish last year 95% coverage. In terms of Penta vaccine, we have been able to do 92% coverage. In terms of Rota vaccine, we have been able to do 96% coverage. PCV13, we were able to do 90% coverage. IPV, we were able to do 88%, and this has been our lowest in terms of coverage. And MMR, we are at 100% coverage. And yellow fever, we did 93% coverage. So by and large, most of the antigens that we've been using, we are in the 90s, with the exception of the IPV vaccine. And I think these results speak for themselves. We have been able to, despite the challenges that we've had, been able to do quite well in terms of vaccination coverage.
All right. Those are really excellent numbers, actually. And I wanted to just ask you, I know geographically how Ghana is situated, and you would have been able to also have persons in those outlying regions vaccinated as well. What has that been like for your team?
Well, again, all the regions have done exceptionally well. The regions that was in the 90s would be Region 4, where we had 89% coverage for all the antigens that I've mentioned. Region 8 at 80%, and Region 10 at 83%. But all the rest, they're all in the 90s, high 90s, so they've done exceedingly well.
All right. Thank you so much, Minister. As we focus now on COVID-19, one of the questions, I know we have addressed it over and over, but I wanted to revisit it just briefly. A lot of persons, actually 130,000 persons would have gotten their first dose of a COVID-19 vaccine, and at this time, we know that some of the second doses, we're starting that process. I just wanted to ask you, persons are still speculating at this time about where we're getting our other vaccines from, and I know that you have been working behind the scenes and so on. Could you just talk to us about that a bit?
Yeah. Well, we're far beyond 130,000 doses. So as of yesterday, we have completed 145,797 persons receiving their first dose. That would approximate to about 29.9% of our population, 18 years and over. We have also been able to administer 5,309 second doses. And so we have already started to, over the last week or so, to be able to give people their second dose and to make sure that they become fully immunized. In terms of the doses for your second dose shot, I think there have been persons who were worried that they might not get their second dose shot. But I want to assure them that we have set aside the vaccines to give them their second dose. The three vaccines that we are using are AstraZeneca, we're using Sinopharm, and we're using the Sputnik V. For AstraZeneca, when we got the doses, we were able to set aside half of it for the second dose. So whoever got their first dose, we have a second dose waiting for you. Similarly with the Sinopharm, whoever got their first dose, we have kept back your second dose because literally it's the same vaccine that you're going to get as your second dose. Only thing is that between the time interval when you get your second dose, it's going to boost your immune system. So for those two vaccines, we have adequate second doses available. Now for those persons who have received the Sputnik V, it's actually two different types of vaccines. So the vaccine that you receive as your first dose is not the same one that you'll get as your second dose. You'll get a different vaccine as your second dose. And again, for those persons who have received their first dose Sputnik V, we have second doses that are already in the country and ready to be given out to those who would become eligible. So there should be no worry pertaining to where you're getting your second dose from. We already have it here. We have it in storage at the bond, the vaccine bond. And so at the appropriate time, we'll roll that out and make sure that everybody can get their second dose, those persons who've already taken their first dose. In terms of moving forward, you probably would have heard me say over and over again that we have enough vaccine for every adult person in Guyana, and that's because we are depending on two main sources. One, through COVAX. COVAX has a number of doses that they said they'll be sending to us. We are expecting, as I've said before, 38,000 doses through the COVAX mechanism that would be coming in to Guyana shortly. We're awaiting the confirmation of the estimated time of arrival for those vaccines. Those are generally going to be AstraZeneca vaccine, and so once we get that, we'll roll that out. In addition to what we're getting from COVAX, the government of Guyana has purchased vaccines, and we have purchased Sputnik V, and those vaccines we have adequate amounts so as to be able to immunize our population. So I don't think there's a challenge with getting vaccine. What we need to do is to make sure that we get vaccines in people's arm. That's where the challenge is.
Yes, sir. As you mentioned the challenge of getting persons vaccinated, I wanted to ask how is the task force dealing with that? But I also noticed that there are a lot of vaccine drives that are taking place currently.
Well, we are working with a number of organizations. So we have a lot of faith-based organizations that have been helping us. We have NGOs that have been helping us. We have other government ministries that have been helping us, private sector entities. So we're working with a combination of organizations to be able to effectively roll out the vaccines to as many persons as possible. Again, while we have a network of health centers across the country, persons might feel more comfortable if we go into the community and be able to do those vaccinations. So we have a combination of things that are going on where we have fixed sites, and in addition to those fixed sites, we also have these mobile sites where with other partners, whether faith-based or otherwise, we've been able to go into the communities. In some cases, we have gone to workplaces, and again, the response has been good. I think one of the big challenge that we have is that for some people, there are still a lot of myths that have been floating around, and they have listened to these myths, and they're now, they harbor these misconceptions about vaccines. And so we're working hard to try to dispel some of those myths. We have several programs that we are running from the ministry's level. This include one program where we are trying to do myth busting. And that is, once we hear whatever the myth is, we try to offer an explanation. So we have been hearing some of the weirdest thing about vaccines, and nevertheless, while for most people they might sound, just weird, we're still trying to, offer explanations so that people can understand that that's not so. It's a daily thing that we have to do. As we learn more, we understand what is preventing people from getting these vaccines. We try to, offer the explanations. One of our big challenge has been that the things that people hear on social media and the things that people circulate on social media. A lot of times people might receive some short clip or video or something of the sort, and they themselves haven't really analyzed it properly, but they would unconsciously just share it with their circle of friends. And a lot of times the content is, doesn't make sense. It's not factual. And by sharing these types of things, you're not doing good. You're actually doing harm, because you're going to prevent people from accessing the vaccine. So we want people to really review, not just to blindly share things, but to review it. If somebody sent it to you, see whether this is making sense. And if it is, fine, you can ask questions and whatever. But if it's not, then don't share it and don't add to the confusion. And so if we all take that conscientious approach, I think we would make a difference. So each one of us, can help with fighting vaccine hesitancy. Because if we don't, then it's going to be harder to reach that goal of herd immunity, because almost all the adults in our population would have to take the vaccine before we can get to that point of herd immunity. So it's very important that if we want to get to that goal, we want to get back to some level of normalcy, then all of us would have to redouble of our efforts in fighting vaccine hesitancy. And we can do that by sharing appropriate information, by talking to people, convince them of the need to go and get their vaccines, help to dispel some of those myths that are circulating. And if we do the combination of those things, I think we will be in a much better place.
Okay, thank you, sir. As you mentioned, Mythbusters, interestingly, we have two here, and we wanted you, of course, to address it. So here goes. COVID-19 vaccine injections, which were administered to the president and the vice president, were fabricated, and the syringes contained water. They both took the Pfizer vaccine. Could you respond to that?
Well, right there's a contradiction, because if the syringes contain water, then they can't get the Pfizer vaccine. But we had our health staff that went over to the State House, and at State House, the president and his family received the AstraZeneca vaccine, and the vice president as well, who was there, received the AstraZeneca vaccine. Early in the day, the Prime Minister also received his vaccine. And I think that is what kickstarted a lot of people coming out to make sure that they receive their vaccines. So we are very grateful that the President took leadership in this matter and have led by example by taking the vaccine, and many others who saw that he had gotten his vaccine then decided to get his. So I want to commend him for his leadership on this matter, and I hope more people follow his example.
All right, I have one more myth-buster for you. Well, COVID-19 vaccines are not halal or kosher because they contain pork products. Yeah, could you?
And that has been a concern for a number of persons, and I've seen in a lot of Islamic countries that this has been raised, and in some of those countries there are Muslim authority or Islamic authority that have reviewed the vaccine and have sent out written instructions that the vaccines are all, past the test. It has no pork products or anything of the sort. When you look at the composition of vaccines, it would have the biological component in terms of which vector is being used. It would have a gene relating perhaps to the COVID-19, the SARS-CoV-2 virus. It would have a gene for that. And it would have other chemicals that you would add to it. So there's nothing there that would be against any religion. And in fact, as I said before, in a lot of Muslim countries, they have authorized the use of these vaccines, and so there's nothing here to prevent persons from using it. And I'm very pleased that we have not had that problem here, because a lot of Muslims have taken the vaccine, and we have had good partnerships with the CIOG, where they came out and assisted us in many communities to roll out the vaccine. So we are grateful for those partnerships, and we hope that maybe the few persons who harbor these myths or circulating these myths would desist from doing so, because there's no truth in it.
All right, Minister Anthony, thank you so much for speaking with us today.
Thank you.
All right. Well, that's it for today's COVID-19 update. Of course, we just spoke to the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.